Picture this. Every morning, you wake up, reach for your pill organizer, and swallow a little white tablet your doctor prescribed years ago. It helps control your blood sugar. Your doctor said it was safe. And because nothing feels obviously wrong, you assume it still is. But what if quietly, over months and years, that trusted medication has been steadily weakening something your body absolutely cannot afford to lose? If you take metformin for type 2 diabetes, the next 13 minutes could change how you manage your health for the rest of your life. What I'm about to walk you through is not scaremongering. It is not anti-medication alarmism. It is a specific biological reality that millions of seniors are living inside right now without knowing it. And it involves one of the most preventable forms of kidney damage in modern medicine. I'm Dr. Lisa. This channel is dedicated to bringing you the latest evidence-based health research, translated into plain language, designed specifically for adults over 60. If you haven't subscribed yet, please do that now so you never miss a video that might protect your health. Now, let me explain exactly what's happening and what you need to do about it. Metformin is the most prescribed diabetes medication in the world. More than 30 million Americans take it. Doctors love it for good reason. It's been used since the 1950s. It's inexpensive. It effectively lowers blood sugar. And it doesn't cause the dangerous blood sugar crashes some other diabetes drugs are known for. For decades, it has been the gold standard first-line treatment for type 2 diabetes. That part of the story is accurate. But here's what no one explains to patients. Metformin does not break down inside your body the way most medications do. It does not get metabolized by your liver. It enters your bloodstream, does its work on blood sugar regulation, and then must be filtered out completely by your kidneys alone, every single dose. And when those kidneys are working at full capacity, that system functions fine. Here's where seniors face a very different situation than younger adults. Your kidneys naturally lose filtering capacity as you age. This is not a disease, it is normal biology. After age 40, kidney function declines at roughly 1% per year. By the time you reach 70, you may have lost between 30 and 40% of the kidney filtering ability you had at 40. The key word there is silently. Kidney decline produces no pain, no obvious symptoms, nothing to alert you that the organ responsible for clearing metformin from your system is working significantly harder than it used to. Now combine those two facts. Metformin depends entirely on kidney clearance. Kidney function drops significantly with age in virtually everyone. When those two things meet, metformin can accumulate in your bloodstream rather than being cleared efficiently. And accumulated metformin creates a condition that most seniors taking this medication have never been warned about. The condition is called lactic acidosis. That term may sound technical, so let me make it plain. Every cell in your body produces lactic acid as a normal byproduct of converting food into energy. Healthy kidneys help manage and clear that acid from your blood. When metformin builds up in the body, it interferes with this process at the cellular level, causing lactic acid to accumulate faster than the kidneys can remove it. Your blood becomes dangerously acidic. Mild lactic acidosis can feel like ordinary tiredness, muscle weakness, nausea, stomach discomfort, difficulty breathing that you might attribute to getting older, but it can escalate. Severe lactic acidosis is a medical emergency. Studies have documented a mortality rate of roughly 50% in severe cases. That is not a figure to minimize. Comment below right now and tell me how long you've been on metformin and whether your doctor has checked your kidney function since you first started it. I read every single comment, and I want to understand exactly what our community is dealing with. Now, let's get specific, because this is where the story gets both more serious and more actionable. Kidney function is measured through a number called eGFR, which stands for estimated glomerular filtration rate. You don't need to memorize that phrase. Just remember the abbreviation eGFR. It is a standard calculation included in a routine blood test, and it tells you how efficiently your kidneys are filtering your blood. Here is what the numbers mean in practical terms. An eGFR of 90 or above means your kidneys are functioning normally. Between 60 and 89 indicates mildly reduced function. Between 45 and 59 indicates moderate reduction. Below 45, the FDA says metformin should only be continued with very careful evaluation. Below 30, metformin is contraindicated. That means you should not be taking it. The FDA updated its guidelines on metformin and kidney function back in 2016, specifically because of this concern. Before that update, any detectable kidney impairment meant metformin was off the table entirely. The new guidance created clearer thresholds, but those thresholds only protect patients if someone is actually measuring kidney function regularly. Here is what the research shows is actually happening out there. A study published in the Clinical Journal of the American Society of Nephrology examined a large population of older adults actively prescribed metformin. The findings were sobering. Approximately 1 in 3 adults over 65 taking metformin had kidney function at stage 3 or below, meaning their eGFR had already dropped below 60, 1 in 3. Many of them had never had a follow-up kidney function test since being initially prescribed the medication. They were continuing their daily dose, trusting it was still appropriate with no current information about where their kidneys actually stood. I want you to understand why this happens, because I believe it is important to be honest with you. Your doctor is not negligent. The medical system is not indifferent, but the average office visit runs 10 to 15 minutes. Long-term medication monitoring for patients managing multiple conditions falls through the cracks far more often than anyone in medicine is comfortable acknowledging. You cannot rely on the system to catch this automatically. You have to ask. Let me tell you about a man I'll call Harold. He was 74 years old, a retired civil engineer, sharp and meticulous. Harold had been taking metformin for 11 years when his wife finally convinced him to see me, mainly because she had noticed he seemed more tired than usual and was mentioning muscle aches more frequently. Nothing alarming, just an undercurrent of not quite right. When I ran his blood work, his eGFR came back at 36, well into stage 3B kidney impairment. Harold had been taking a full therapeutic dose of metformin for over a decade with no dose adjustment and no kidney reassessment. We transitioned him immediately and carefully to an alternative medication better suited to his current kidney function. 3 months later, his wife told me she had her husband back. Harold was not unusual. He was typical. But I want you to hear something important before we talk about what to do. There is a second risk associated with metformin and kidneys that receives almost no attention. Yet, it affects seniors undergoing some of the most common medical procedures performed today. If you have ever had a CT scan with contrast dye, a cardiac catheterization, a coronary angio, or any procedure involving intravenous contrast material, this applies directly to you. Contrast dye used in imaging puts temporary stress on the kidneys. When metformin is present in your system during that stress, the combination dramatically increases the risk of acute kidney injury. This is why standard medical protocol requires metformin to be held for at least 48 hours before any contrast procedure, and not restarted until 48 hours after once kidney function has been confirmed stable through testing. Many seniors go through scheduled procedures without anyone mentioning this. Some go through multiple procedures over years. I hear from people regularly who have never been told to hold their metformin before a scan. And here is the thing that concerns me most. This is entirely preventable. One conversation with your prescribing physician before any scheduled procedure is all it takes. Has your doctor ever told you to hold your metformin before a CT scan or cardiac procedure? Comment below, because the number of people in this community for whom the answer is no is something I think we all need to see. So, now let's talk about what you actually do with this information. Here is exactly what I want you to do this week. Step 1. Get your eGFR tested. Call your doctor's office this week and ask for a comprehensive metabolic panel specifically to check your kidney function and your eGFR. Do not just say you want blood work. Say those exact words, comprehensive metabolic panel and eGFR. This test is covered by Medicare and by virtually every private insurance plan. It is a simple blood draw. Step 2. Know your number. When the result comes back, write it down. If your eGFR is above 60, your kidneys are in a range where metformin is generally considered appropriate, though ongoing monitoring still matters. If your eGFR falls between 45 and 60, ask your doctor directly whether your current dose needs to be reduced. If it is between 30 and 45, this is an urgent conversation. You and your doctor need to evaluate right now whether continuing metformin is appropriate at all. If your eGFR is below 30, do not wait for your next scheduled appointment. Call your doctor today. Step 3. Ask about a monitoring schedule going forward. The American Diabetes Association recommends eGFR be checked at minimum once per year for anyone on metformin. For adults over 65, checking every 6 months is a reasonable discussion to have with your doctor, given the natural decline in kidney function that comes with aging. Put it on your calendar. Make it as routine as your annual flu shot. Step 4. Before any imaging procedure, any procedure that involves contrast, dye, remind your prescribing physician and the procedural team that you take metformin. Write it on a piece of paper, if that helps. Bring it with you. Ask explicitly whether you need to hold the medication before and after the procedure and for how long. Step 5. Recognize the warning signs that demand immediate attention. If you experience unusual muscle weakness or pain that feels different from ordinary soreness, severe fatigue that comes on without clear reason, stomach pain, vomiting, rapid or difficult breathing, or any sense of confusion or lightheadedness, contact your doctor or go to the emergency room and make sure to tell them you take metformin. This information is critical for any clinician trying to evaluate these symptoms. Do not assume it is just aging. Now, if your kidney function numbers indicate that metformin is no longer appropriate for you, I want you to know the treatment landscape for type 2 diabetes has expanded considerably. You are not without options. SGLT2 inhibitors, a class that includes medications like empagliflozin, have actually demonstrated kidney protective properties in multiple major clinical trials, including MPA-REG-A outcome published in the New England Journal of Medicine. GLP-1 receptor agonists are another class with strong evidence and a good safety profile for patients with kidney concerns. There are good alternatives. Your doctor can help you find the right fit for your specific situation. One thing I must be clear about: do not stop taking metformin on your own today without speaking to your doctor first. Uncontrolled blood sugar carries its own serious risks, including damage to the very kidneys we are trying to protect. The goal is a supervised, informed transition, if one is needed, not an abrupt stop that leaves your diabetes unmanaged. I also want to share the story of a woman I'll call Eleanor, 68 years old, a retired school librarian with an extraordinary memory for details, who had been diagnosed with type 2 diabetes at 61. Her kidney function was perfectly normal at the time of her diagnosis. She started metformin. It worked well, and for 7 years, no one retested her kidneys. It simply fell off the radar. When a new internist ran a comprehensive panel during a routine visit, Eleanor's eGFR had dropped to 41. She had been on full-dose metformin the entire time. She told me that what bothered her most was not the transition to a different medication. It was that no one had ever explained to her how metformin actually worked or why the kidneys mattered so much. She said if someone had told her that in 2017, she would have asked about it every year. Eleanor is doing well now, but she should not have needed 7 years to get that conversation. Here is the single most important thing to take away from everything I've shared today. Metformin may have been exactly the right medication for you when it was first prescribed. The question is whether it is still the right medication for you now, given where your kidneys are today. Those two things are not automatically the same. And one simple blood test can answer that question. Write this down. Get your eGFR tested. That is the one action that matters most. Comment below with one of 3 things. Comment getting tested if you are going to call your doctor this week. Comment your eGFR number if you already know it and let this community see where we stand, or comment sharing this if you know someone on metformin who needs to watch this video today. These comments genuinely help me understand what seniors across this country need most. If this video gave you something useful, please subscribe to this channel. I publish new evidence-based health content every week, specifically designed for people over 60. And next week, I am covering a common blood pressure medication that may be quietly depleting a critical nutrient affecting your heart rhythm, your muscle function, and your sleep quality. And most doctors never bring it up. You will not want to miss that one. I'm Dr. Lisa. Your health deserves accurate information and real answers.